Hello and welcome to another ICM or Institute of Conflict Management Roundtable. This is the third one we've run, and today I am joined with two of my fellow board members and we're looking about the subject of mechanical restraint. So first I'll welcome both of them to the group, but first off, my name is Andy Baker. I am the Managing Director and Lead Trainer of Able Training Support Limited that delivers conflict management and physical intervention training across the health and social care sector predominantly. Next we have Phil Hardy. So please introduce yourself, Phil.
Yeah, Phil Hardy, founder and chairman of the Institute of Conflict Management, and also founder and owner of Secure Care International Limited, another training organisation specialising in the prevention and management of work-related violence in quite a few sectors.
Yeah, perfect. Thanks, Phil. And Travell.
Yeah, no, thanks, Andy, Phil. And yeah, good afternoon. I'm Travell Henry. I'm Director of MVC Awareness, which delivers training similar to my two colleagues here. I'm also the co-founder of a charity called Wordly Wise, where we give talks to children in schools, trying to inspire them, motivate them, build some resilience within them, really. And hopefully as the webinar goes along, as with my colleagues, you'll get to learn more about us.
Perfect. Thanks, guys. So we had a chat in advance of this and we decided that a good topic to cover would be looking at mechanical restraint. And I know that both of you come from slightly different approaches. Obviously, Travell, you were previously a police officer. So you've used handcuffs at numerous points in your lives. We just had a little joke before that obviously keep it professional for the the section we're doing today. No 50 Shades of Travell. Also, Phil, you're involved in an awful lot of teaching and educating around mechanical restraint devices as well, because of the environments that you work in, aren't you? So if we start off with Travell, what's your take on mechanical restraints? Because obviously there's a lot of controversy about it. Some people are absolutely against, but yeah, where do you feel? Because it's more handcuffs you do a lot of work in, isn't it?
Yeah, handcuffs links into it. But just before I kind of just respond to your question, just one point of reference there for you and the viewers' information. Although I trained at Kent Police around police and personal safety, etc., for 20-odd years, I wasn't a police officer.
Oh, okay, sorry.
No, don't worry. A lot of people, because of what I've done and the knowledge I have, assume so in itself. So if you're going to do intros, I normally just be transparent with people, that's all. But yeah, the views around handcuffs, from my broader perspective, then I think there is a place for them. Absolutely, 100% across, I'm going to say most sectors, which is going to sound controversial to some people, but we'll no doubt as we go along, we'll talk about reference to law, so in line with the law. But I think that principle around, they shouldn't be applied until one's established control, which I'm sure is going to open up a lot of debate as we go along. But I think there is a place for handcuffs, though, as a fairly short answer as my introduction.
Yeah. What about yourself, Phil?
Well, my first encounter with handcuffing was with the Master's Prison Service back in the mid-80s. I was a prison officer for a while I was waiting to complete my training for being a physical education instructor with the Home Office, which involved the control and restraint training. But handcuffs of varying different types were used within the prison service. Arrest cuffs and the detainer cuffs for Cat A's, for transportation and security in courts and things. So it wasn't a regular piece of equipment that you would use on a day-to-day basis as a prison officer. But if you were transporting somebody between prisons or to court, then there was a chance that the handcuffs involved somewhere, either in the van or in the court itself. And body belts were still in use in the prison service back in those days. So I had one experience of having to fit a body belt, which was an eye-opening experience.
Right. This is where I plead ignorance. I haven't worked in either the police or the prison service. So yeah, what is a body belt? I think I've got an idea in my head of what they are because I've seen them potentially in TV programs and movies. Is what I'm picturing correct there?
If you picture a weightlifting belt,
yeah,
with handcuffs attached to the sides, that's your bog standard. It was the bog standard body belt within the Home Office prison service when I was in. Well, as I say, it's a good 40 years ago now. So
yeah.
Since then, we are still involved in some mechanical restraints in some of the settings that we work in. We do work with the airline industry for the prevention and management of unruly and disruptive passenger behaviour. And as they can't call the police or security or anybody on board an aircraft at 36,000 feet, then they have to deal with that incident until they get the plane back on the ground. Hopefully, secure the passenger and push on to the intended destination, or divert, which is a very costly way of dealing with it. But so we still do train some handcuffing, and in other settings we use mechanical restraints of a softer nature. So mechanical restraints in most instances are for transporting somebody, making sure that they can't escape or run away. It wasn't usual in the prison service to be handcuffed to a prisoner if you were on certain duties. And then you get applications for medical and care procedures to prevent someone harming themselves or others. And as a substitute for prolonged physical restraint, which carries its own dangers. So there are certain circumstances where using belts or straps or handcuffs or wrist restraints, whatever's available, have uses as an alternative to other measures that might be introduced. I think that's where we're at with mechanical restraints these days.
I think there's a lot of controversy around the mechanical restraint. Both of you, as you started talking, your first introduction, both was within environments where obviously it was the criminality. Do you think there's still kind of this, because we'll come onto the side of the soft restraints and things like that now are starting to be introduced and being kind of utilised in different settings, and they've definitely got a counter to I think everybody has used mechanical restraint at some point. If you've got children, you have mechanically restrained them into a vehicle and not seen it as inappropriate when you've had a baby seat and harness. But there's this controversy. Do you think that's very much linked to the kind of the link with handcuffs and criminality, that there's still that kind of resistance to it?
I think there is an element of that. I also, from conversations that I have with lots of people, think there's although they still believe if you restrict police to bleep prison items an issue of equipment, which they're not. So I think that's one of the first things we have to get across to lots and lots of people in terms of there's not a police item or prison item of their equipment per se. I think as well aligned to that, yes, by default, there's been history, hasn't there, which everybody's seen linked to criminal activity within itself and there, but as Phil quite rightly touched on there, and in any sector environments, usually from a broader perspective, and without going off at a tangent around, risk assessments, etc. But, what's the rationale for? Because, Phil was talking about, for example, patient transport, person transportation, then by default, isn't there some rationale around the person's behaviours, which are, let's say, challenging, violent, aggressive, whatever. So that element of let's put them in cuffs before they, if you wish, start to become challenging in any form or themselves. But I think that's the biggest barrier to get across, is the fact that they're not police or prison service items of equipment.
Actually, both people's perception of handcuffs is what you see in the movies. It's people being arrested and handcuffed behind the back, usually with a fair amount of aggression and violence involved. But in my experience, wrist restraints have been applied with the person's compliance. That because it's for their benefit. It allows them some certain amount of freedom. It makes them feel safe. It makes them feel secure. I'm not saying, not every use of a mechanical restraint is at the person's request, but quite often it's done with the person's compliance as part of the procedure that they're going through. This is necessary. You can think, like you mentioned, if anybody's got children, you strap them into a pushchair or a car seat. Every time you get in a car, you put a mechanical restraint device on. They're used for safety issues, for the person's safety, for somebody else's safety. And we touched on the transportation of people. I've had experience of transporting prisoners between various establishments, and handcuffs would be used. But I worked in children's services and care settings where transporting somebody to the dentist or to the hospital, where it's prescribed as part of that process that additional mechanical restraints will be used, because you don't want the person sat in the back of the car attacking the driver, or you don't want them fighting with the dentist when they perform mental procedures on the teeth. So there are times when it's not purely an enforced restraint of the person. It's because it's part of the procedure.
Yeah. Well, it's a proactive rather than a kind of a reactive, which I think a lot of people, when they're thinking of handcuffs, maybe, as you said, they've picked up their knowledges from movie, TV, or even worst case scenarios they've seen, documented in the media, where it's been a very reactive use of a mechanical restraint. So it does look quite violent, aggressive in those circumstances. Whereas you said there, sometimes or quite often, it is more of a preventative measure or a proactive measure going, look, as you said, it's consensual. We need to transport you. You need to put these on to make us and everything safe, rather than us having to hold you. Which is, I know you've done some work with the like air ambulance film, and it'd be good to potentially talk about that as far as, because I know they've introduced mechanical restraints to a greater degree than they had it before.
I mean, that was one sector that the sight of handcuffs, metal handcuffs, or plasticals, it just was no. We don't want to we don't want to go down that route. We're not police. We're not custodial services. We're looking after patients on board air ambulances. They were really put out with the prospect of having to apply handcuffs to somebody in a air ambulance environment. But they had to measure that against the risks of somebody becoming violent in the confined environments of the helicopter, in very close proximity to the cockpit when the people were flying the thing. It came about through a death, somebody that might brain injury, came to on the helicopter, completely disorientated, very noisy environment. The crew all wear helmets and a microphone up so they can communicate with each other, which in this particular incident, the person became violent and managed to kick the steer patch out of the helicopter door and then jumped before they could restrain it. And that led them to approaching me around mechanical restraint on board air ambulances. And we actually designed a piece of equipment specific to that environment. And the first part of the training and the procedure is to get complaints from the passengers. Say, look, this is for your own safety. We're going to apply these soft mitts to you so that you can't grab anything, cause any problems with the flight of the helicopter or with the medical equipment while we transport you from point A to point B. So the first stage of the whole thing is to get the patient's compliance that this is in their own interest and for their own safety to have these soft mitts applied for the period of the flight, which might be 40 minutes. It's a short period of time. We do a non-compliant application for people that, for whatever reason, become resistive or violent on board the helicopter afterwards. But as anybody will tell you, applying mechanical restraints with somebody that's resistant is a much more difficult operation than somebody that's compliant. And the first thing you need to be able to do is control the person. So there's a certain amount of physical restraint involved in applying mechanical restraints to a non-compliant.
Well, that leads us over to what you mentioned there, Travell, isn't it? I think you said that it's a potentially controversial point as far as it's gaining that control before mechanical restraints are applied, if it is a more reactive situation or responsive situation. Do you want to just expand on that for a second?
Yeah, sure. And for me, and just a link in there, and a couple of things we've been saying between us, and I think, whilst we three appear to understand it, there might be a lot of people out there confused because we're using terms like compliant handcuffing, cooperative handcuffing. But if you don't mind, what appears to be wrong with those phrases?
Yeah. Well, There's nothing wrong with them. I think it's perception. Yeah, perception sometimes. Yeah.
But the obvious, don't get me wrong, the obvious question somebody asks, well, if they're cooperative or compliant, why are you handcuffing them?
Yeah.
And that's why I'm saying we get it, but it's a fair question for people to ask. And I think, well, just to expand, just something we're aware of, but again, just that we get it across to everybody else. We come back to, and I've said it myself, if you're doing that, let's say that patient transportation, then it might be the rationale for putting them in cuffs. We've had the conversation, the cooperative, the compliant, but the evidence behind that, and it needs to be supported, is, broadly speaking, we perceive or believe the person's got the intent, opportunity, or ability to cause harm. And that's the bit that's often missing from people's statements and reports. They'll say compliant, cooperative handcuffing, but there's no substance behind it. And to use the old cliche, it's not black and white, but if it wasn't written down, it didn't happen. We know it's much broader than that. I'm just trying to make that analogy. I'm putting my hand up here and acknowledge we use terms like cooperative and compliant, and sometimes we don't expand to other people. Well, I think that's the obvious question. It's a fair question, isn't it? We don't know what we don't know. So why limiting their limbs to being cooperative? So, forgive me, it's just that link for other people get the appreciation when we say things like compliant and cooperative, then there is substance behind it.
I think I find the seatbelt to harness analogy the easiest way of explaining the use of physical intervention generally. That we've all used a physical intervention being a seatbelt, which restricts our movement and behaviour to some degree, but we class that as a non-restrictive because we can take it off. Whereas if somebody doesn't have due to their physicality, their shape, size, build, core strength, so the physical vulnerabilities means that isn't an appropriate way of keeping them safe, or the circumstance. So a racing car driver is harnessed in. If I go on a roller coaster, I'm harnessed in. That's still a mechanical restraint, but because the level of risk is higher, a greater level of restriction is required. But with a child, why can't they be in a seatbelt? As you said, we don't wait for the child to start climbing out the car window before we go, maybe a harness would be a good idea. We have to kind of look at this. What age are they? What risk factors are they? And therefore, is that an appropriate level of restriction to keep them safe? But as you rightly kind of referred to there, we're always using the least restrictive method. I'm not going to just restrain a 15-year-old in a car because I think, well, he might try and climb out. So it is very much based on those kind of and obviously that's a generalization with children, but within care, within individuals, within the care service, or with any service, we do it much more person-centered, don't we? So it is more individualized as far as a risk assessment rather than a generalization to some degree.
Well, I think there is that element behind it as well, though, isn't there? The fact of, whilst we want to keep the risk in perspective, but we're technically exposing people. So we, from the introduction, we've got the perception that a lot of people don't like it, don't like the use of medical restraints, etc. Then further compounded with, the facts of a technical assaulting by taking away the free move for all the right reasons we've said, and it's those factors again that come into play, and for me, and I thought, just for some people, just to clarify that when we're using these terms, we do reference and as part of the training, as part of the policies and procedures. When I say we all trainers are doing that, and I'm sure they are. But I think as well, that balance within here, and we talked about reactive. Well, the whole principle around this, isn't it, is we shouldn't be cuffing anybody to establish control. But then, people. There's a million and one videos and go, I'll drag this down off YouTube and so show me where they've got control before they handcuff them. Well, that balance off, isn't it? We've gone into a dynamic assessment of risk, and ideally, in an ideal world, under restraints, they've managed to get some element of control over them where they can have a conversation, albeit it might be an assertive conversation, towards putting the cuff on, or cuffs on, or whatever mechanical restraint equipment it is. I think the principle shouldn't change. We should not cuff anybody or restrain anybody, mechanical restraints, people using cuffs all the time as a term, but we shouldn't apply them until we've established control. That principle for me should never change.
I did see a video one time, which is not the nicest of videos. I think it was, I can't remember whether it was a British or an American, but it was a police officer went to interact with a gentleman who became verbally and then physically violent. And I think he ended up stabbing her with a pen or something like that. And it's kind of a bit of a review on the video from a point of managing emotional responses and reactions. And because she had her cuff cuffs in her hand. Rather than just being able to defend herself from the pen, she was so busy trying to get the cuffs on him while he was stabbing her with a pen. Is that kind of what you're referring to there, as a kind of she was trying to use the mechanical restraint to gain control rather than gain control to then initiate, and probably shouldn't have gone in on her own anyway on that circumstance. There's lots of problems with maybe the actions.
No, then yeah, just picking up on what you said there, then that balance between, and again, I'm making some assumptions to the footage, but she got to the point where she felt she'd established enough control then to go forward and apply the cuffs. But in that interim, as you say, I think it was he you said, he's then, become aggressive, violent, etc. But then I think a lot of people have that fixed mindset. I was going to apply the cuffs are in the hand, and they find it difficult for many reasons to come out of that fixed mindset. And as you say, then it becomes a little bit of a bundle with these cuffs in the hands, which are kind of getting in the way of them having, being able to establish control before they can go to the next option. So, and I don't say that as a criticism. Yeah, they've made that mind up, however they've assessed it, have now established control. I can now put the cuffs on, and then it goes a little bit awry. And as you say, you see people with the cuffs in the hand from this, and it doesn't look good.
Anybody that's been involved in a real life restraint knows that there's no amount of training or preparation can prepare you for the real life situation. They're all different. I've been involved in enough live restraints in the environments I've worked in, to talk about that from an experienced position. It very rarely goes according to plan. Obviously, a planned response is the best option you can have, which is why in care settings, the right care plans, which run through strategies for managing the behaviour, which may, at crisis point, include physical intervention or mechanical intervention. It's not, it's not that unusual for there to be a prescribed physical or mechanical intervention at a certain point in the person's behaviour, providing it's on that hierarchy of response. It's got to that point where this is now our only option. And often in care settings, you get to the point where you've got physical, medical, or mechanical intervention. That's your point. That's where you got to in the strategy, and you have to make one of those choices. And as I said, prolonged physical intervention carries its own risks. And if there's a, then why not consider it and include it in that strategy?
Well, I think there's some. There's a perception. I definitely feel there is a bit of a perception from maybe people again who aren't in the know, who is looking at it from an external point of view, that mechanical is almost, if you look at it as a kind of hierarchy, that mechanical is worse than, or either classed as more degrading or more of an infringement on somebody's human rights than necessarily physical or manual restraint is. I think that's a perception from some people. I don't know whether you found it, but I definitely feel that's maybe the undercurrent. But as you rightly said there, sometimes prolonged restraint, well, what would you rather have? And you referred to it as well, Travell, as far as some form of cuff or mechanical harness, whatever it is. Well, would that be more intrusive or less intrusive than 3 or 4 or 5 people having to hold me? For me, that maybe that's being in the know, being in situations, being on the receiving end of, based on scenarios and stuff like that. I'm like, yeah, I know what I'd prefer. If I can sit upright with some cuffs on, I think that I'd find that more comfortable than having 8 people piled on top of me. So, and which one's also lower risk as well.
I think it's interesting, isn't it? Because whilst you can't take the use of force element out of it, because it is, within the broader context, I think exactly what you just said there, the fact that you're taking away somebody's liberty, the human rights element comes into it, and people understandably are concerned about that. But I think, the point they often miss, well, you've either used your presence and or hands on them anyway, so you've already taken the liberty away. But, suddenly because we've used this mechanical item of equipment, then people are suddenly, and I think, well, it kind of slightly irrelevant, so use of force is slightly different if you use in the context of what I'm trying to talk about here. And it is, well, we've already had hands on them and people aren't always too disturbed by that. Yeah. And suddenly we put handcuffs on them, go back to it. If they're quite verbally, physically responsive to putting handcuffs on, then there's no more force in the hands on that were there. And it is interesting, human rights, yes. People, I think, get a little bit carried away with it at times.
Something else you mentioned there, Phil. I know there's been some. I have to plead ignorance here and borrow whether there is a court case or a precedent that was set related to manual handling and mechanical restraints, because I know that obviously within manual handling practice, if a piece of equipment can be used to reduce the risk to a lower level, then it should be utilised under manual handling regulations. And I believe there was a case where the use of mechanical restraints was justified under the health and safety and manual handling regulations. Are you either of you aware of that, or do you use that as far as when you're teaching or anything?
I can't speak about that particular case, but I can certainly think of half a dozen instances where mechanical restraint was the best choice as part of that process or procedure that you were going through. It made more sense than physical restraints. It was in the person's best interest. So you can't just rule it out. It has to be in the toolbox. But obviously, you have to justify why you've included that in the toolbox. At what point in the strategy will it applied? And then you've all the issues around training and the welfare of the person that it's applied to, and everything else. Just a couple of instances that spring to mind was an old girl, Mary, she had very bad feet, is the best way I can put it. They were in horrible shape. Her toes were all going in different directions.
I did wonder what you were doing with your hands. I didn't know it was going to go to feet, and you're doing that with your hands. Anyway, you created some incredible imagery there, Phil.
Yeah.
She had talons.
It was a sight to see. But anyway, as a result, the chiropodist had to treat the feet on a regular basis. It was about once every 6 weeks. Get rid of the corns and the bunions, try and cut her nails, just to make her feet feel more comfortable, which she did. And after the procedure, she was always a much happier person. But she hated the prospect of going through this treatment with the chiropodist. And it was taking the chiropodist above an hour to do her feet. And he's working with scalpels and toenail cutters, and she's kicking and fighting and carrying on. And it was a stressful situation for Mary. It was a stressful situation for the chiropodist. And it involved 3 staff trying to hold her while this procedure took. And having sat down with the clinical psychologist who was in charge of the case, the manual handling people, the advocate, the parents, everybody else involved in that, in Mary's care, we came up with a way of securing her. And we got it down to about 15 minutes to get her feet done and get the chiropodist out of there, which was a better experience for Mary. The chiropodist was absolutely relieved and felt like it was a much safe procedure. It was in both Mary's best interests and was the simplest way of getting the job done, administering that care. Mechanical restraints are not that unusual in NHS settings, where you've got people pulling drips and things out. They will they'll stop that happening. Because it's in the person's best interest.
Yeah.
I think the lines to that, and linking back to your question as well, Mike, Phil, I'm not specifically aware about health and safety linked to handcuffing, but if you link it to having to manage people on the ground, whether that's prone or supine, for example, then I think within that context, whether they've been managed on the ground and have to be placed in some form of mechanical restraint for the brought up onto feet, or whether they've been placed in a mechanical restraint and happen to be managed down to the ground and then brought back up. So trying to the whole picture. But I think, and linking directly back to your question, then that balance of, isn't it, by default, then the person becomes a load when they're under restraint, whatever form of restraint. And as we know, then that balance of, we're managing unsteady load because the person doesn't want them to go where we'd like them to go when we'd like them to go themselves. So those factors then can play a part, can't they? And it is that balance about, the appropriate processes to try and manage people to the ground and try and bring them out to feet as soon as it's reasonably practicable. So I think there certainly, there'd be lots of we three and many others will be familiar with what, in the right context of having to manage people on the ground, then that person becomes, if you wish, an unsafe load.
This is where, again, I sometimes find this is why I feel the ICM has such an important role to play when it comes to prevention management of violence and aggression, because within something like the health and safety, both of you have mentioned aspects of this. And we have to look at it from both sides. Let's say we are supporting somebody with delirium, for instance, within an NHS setting, where they feel that these people are trying to perform experiments on them, or they're been abducted by aliens, and therefore they're trying to perform experiments on them, and then they are harnessed or restrained in. Then straight away, that only exasperates the potential PTSD that could result from that occurring. So I completely kind of get this adversity in some way, or the perception of criminality associated with mechanical restraints, or we use mechanical restraints a lot with animals more so. So is there that kind of negative connotations around it? So I think we have to be very, very sensitive around the use of mechanical restraints and how they are. And this is where I think we'll talk about the introduction of the soft cuff and stuff like that, the MITs that Phil mentioned earlier, that are softer and less connected with criminality, I suppose, maybe. But we also have to look at, with prolonged restraint, you gave the example there of the chiropodist feeling much safer, and probably being much safer because of the use of mechanical restraints. You also mentioned the transition from a person down to the floor and up from the floor. And if we are taking the manual handling or any health and safety risk, it is also reducing the risk of the people doing the physical intervention or restraining or having to take control of the situation, not just about the risk related to the person that is distressed or overwhelmed. We have to kind of look at both parties, and I think that's sometimes where the view is skewed, and whether rightly or wrongly, but towards the person who is vulnerable. We have to consider everybody within that particular circumstance. Have you guys found that is sometimes missing, or have you encountered that kind of that lack of view?
And I think certainly, sorry, Phil.
Oh, you're okay, Phil.
I think certainly, yeah. I mean, we think about the whole spectrum of training. I think, we often have to remind people, first and foremost, this training's for the staff. It's duty to oneself, because i.e., if the staff don't feel safe, then are they going to provide the best possible service to the people who are there to support within itself? Firstly, aligning with that is third parties in close proximity, and then the person themselves, from abroad. But all three are intrinsically linked, of course they are, absolutely. But I think it's trying to remind people, firstly and foremost, they've got a duty to themselves. We don't want people to try and intervene. If they feel they're going to be harmed in a bad way, let's try and say, to use a little bit black and white analogy, then, we'd appreciate and understand why people don't feel confident enough to go forward to try and support and manage that person. So I think, that's something we need to get across to people more and more.
And it's been alive to the environment and to the circumstances involved in the whole management of the behaviour, because you'll have different resources in different environments available. The way that you apply a mechanical restraint can differ depending on the environment. The common practice is for somebody to be handcuffed with the hands behind the back. If you're arresting somebody, you should all want the cuffs at the front where they can use them as a potential weapon. But if you're transporting a prisoner between establishments and they have to sit in a vehicle, you would handcuff them to the front. You may handcuff them to the person next to them, or depending on the circumstances, but it's much more comfortable to transport somebody with their hands handcuffed in front. In the airline industry, going back into the late 90s, when restraint were part of cabin crew training, there was a lot of people advocated handcuffing behind the back, but that's a very difficult. That's not going to work if you have to sit somebody in an aircraft seat and put a seatbelt on.
Yeah.
And there was do you remember Wenger case? Died at positional asphyxia where he was being deported, and the coroner's report said that you in future you should handcuff to the front, because that way the person's not doubled over in the seat because the hands are handcuffed behind them. So the environment or the process changes the application. It could change the equipment. Like I say, with the helicopters, we had to actually create something for that environment. So it's looking at the needs within that environment, within that setting, and on that overall strategy to manage that person's behaviour, and where the end point of the behaviour can be violent or self-harming. What are the options that we have available? And mechanically restraining somebody has got to be one of those options. It's got to be a consideration. It might be something you consider and dismiss, but for God's sake, don't dismiss it out of hand, because it might actually be the best option.
I think it's interesting to add to that as well, though, in the environment, but I think individual perception within the environment, or team perception if you're working as a pair, etc. Because, a lot of programs around mechanical restraints, talking about handcuffs, let's say, then generically, now I'm not saying these are the phrases I use, but I'm just trying to use this reference now in terms of the webinar. But if people believe the situation to be low level, then they're likely to cuff them to the front. If they perceive or believe to be higher level, then to the rear, which is a factor within that as well. And like Phil was saying, the planned interventions, either some known factors leading up to it, then that will have some reference points to how you may, in the moment, and I'm just using those as broad headings, and I think that becomes a key factor in a lot of these as well. So that was a small sense, handcuffed to the rear, then if they're going to be transported, it's a discussion and decision that has to be made. And as we know, not everybody who's been handcuffed to the rear and transported will be cuffed to the front themselves. No. Yeah.
I mean, you could transport low risk or low category prisoners sometimes, but the risk wasn't particularly that they were going to be violent, but there was a good chance, given half a chance, they would run. All right, so there was ways of handcuffing them to each other so that the hands were crossed, so that even if they did decide to run, it was very difficult to pick up any pace because you were cross-cuffed. So the application was designed to restrict or reduce the risk, which in this case was legging it. If they got half a chance, they would run. So you would handcuff them in a way that made it very difficult to run.
That's interesting. Sorry, Bill.
It's okay. But I think it's what's the potential risk or the potential behaviour associated with this process that we're trying to do, whether it's transporting somebody, whether it's administering care, whether it's to restrict the movement for their own safety or somebody else's safety, then you need to take all that into account when you're deciding what tools you're going to put in the toolbox. And as I say, if mechanical restraints are available, and there are quite a few different variations available now, then it must be in the mix for consideration. Even if after that consideration you decide not to use it, then at least you've explored all the options.
Yeah. Well, how can you decide on what is the least restrictive until you have actually compared what all the various forms of restriction, essentially? Yeah.
But I'm going to be a little bit of a broken record, though. But part of that, isn't it, is around capturing the data and the analysis, etc., to evidence the need for
option
here.
What's the justification? What is the justification for adding this? As part of the measures that we're going to consider as that overall strategy for managing this situation and this person's behaviour. I keep saying situation because the behaviour sometimes is almost incidental to the procedure. It's just a byproduct of the procedure. Sometimes the behaviour is the main aspect of the situation, and that's what you're trying to control. It's part of that overall strategy that you have in place from reducing and removing the triggers. I'm talking to the converted here, I know, but even when you've come up with that, and all the different elements to it and how it all works, you can guarantee anybody that works in care settings that the behaviour will change. Right? You find a solution and it no longer works, so the person changes their behaviour. So you have to rethink the whole strategy all over again. But sometimes the introduction of a mechanical restraint, because it puts an end to the excitement that the person got out of the behaviour, because it's no longer fun, stop doing it.
Mm.
So you come up with a solution that you introduce, and then you go back and see how it's going 3 months later, and the staff say, we've never actually used it. We used it twice, and because he wasn't getting the enjoyment he used to get out of it, dementing all the staff with his behaviour, he stopped doing it.
Mm.
It's no longer fun.
Yeah.
We put a stop to it like that, and therefore it's not. He doesn't get the enjoyment out of it that he used to get, so he stopped his behaviour.
I think it's interesting as well, isn't it? Because, I'm just conscious that, obviously, like all these topics are very vast. We could spend all day talking about all aspects of it, and still be a very informed conversation. But I think if I'm calling it from a handcuffing perspective, then, for those who perhaps aren't informed, to be aware of, there's in effect, aren't there? There are either rigid cuffs, in no particular order, by the way, rigid cuffs, hinge cuffs, chain link cuffs, a form of soft cuff, and then the right and appropriate plastic cuff.
Yeah.
So, not cable ties, if you wish, in itself, although there's no law against cable ties, but we know the issues. But they're the 5 areas, and the conversation we often have with organizations, clients, for ease of introduction is, well, we don't like rigid cuffs because, they're too harmful and hurt people. So we'd rather have, let's say, chain link cuffs.
Yeah.
And I have to be honest, whilst I respect their view, what my point to them is, by and large, is, but the whole philosophy behind this is that you don't handcuff until you've applied control, themselves in the first instance. So whilst I acknowledge one is potentially can cause a bit more injury than the others, but let's keep in mind that handcuffs all day long are a complex technique, and we can't get away from that. Then it's the soft cuffs. Whilst I understand the argument it's less injurious, but it's certainly much more complex and much more resources and people involved to apply them. So there's that measure, for an organisation, because we'll do a needs analysis with them, but to give them an informed view around which way they want to go.
This, I think, is a problem with sometimes people from the outside, I think, sometimes look at risk assessments with what they perceive as an objectivity, that there's a right and wrong way of doing it, but there is so much subjectivity to it, because it is, as you said, like whether it be soft cuffs, hard cuffs, but it's duration being held for, how many people are available to actually apply them in the first place. There is so many variables in that moment, in that instance, that or whether we're doing a pre-written risk assessment or we're doing a dynamic risk assessment, that you get 2 different people go in, they're going to have completely different opinions potentially of what was right and what was wrong. But there's this expectation that, well, there's one way of doing it, there's a right way and there's a wrong way. But never. It's because I've got to justify why that was my risk assessment in this particular minute from my perception, from my experience, from my knowledge and competency. And I think that's where some people really struggle with the whole concept of risk assessments generally, not just in mechanical restraint, across the board. I think they really struggle with that. They think it should be is it safe or not safe? They just want absolute black and white.
Well, but I think that is, I think in the wider context of this subject, that's the beauty and the frustration at the same time, though, isn't it? I have the view it's 100% subjective. I have that view. I do. There are, I say this to people tongue in cheek. I do explain it afterwards. There are no wrongs or rights. I do go on to explain what I mean by that. But you just explained very well.
Yeah, you just have to justify it 100%.
Yeah.
Let's just talk a little bit, Ben, about, obviously, there is lots of new devices. Phil's already mentioned one that he personally developed as far as the SoftMIT system that on the air ambulance. And I know that you've worked with the airlines as well to adapt and find specific things for them. And obviously you mentioned soft cuffs already. So, and obviously we're not going to spend the rest of the roundtable kind of going through all of the different forms of mechanical restraint. Obviously, there's some individuals out there who specialize in mechanical restraints as well, who I know of closely associations with the ICM. Do you think there is this shift towards the soft restraint side of things? Do you think that's a good move, or do you think it opens it up to potentially increased misuse?
As I say, the main consideration is how is the equipment going to be used, for what purpose, on who, and in what environments. All right, and that should help you narrow down your choices of course. I'll go back to the airlines in the list when they actually asked for mechanical restraints, we try to talk them out of it, because it's not the environment of an aircraft is not very conducive to restraint.
Mm.
And having been involved in live restraints, and then having trained people on board aircraft in the environment that they work in, I said, if you can avoid this at any cost, avoid it, because this isn't a good environment to restrain people in. But as I said, diversions are very expensive, and the airline's decision was to introduce equipment that would allow them to push on to the intended destination instead of trying to divert, which meant trying to get the person into aircraft seat so that they could land the aircraft. My first choice was chain link cuff, because that was what I worked with. And when I had to do an enforced handcuffing, which I have to say I only did on half a dozen occasions, but having experienced the difficulty in handcuffing somebody that didn't want to be handcuffed at any cost and was prepared to fight the whole way through and resist having the things applied, the chain link allows you a little more flexibility. If you're trying to, if you've managed to get one cuff on and you're trying to get the other cuff on, a chain link cuff allows you some movement and a little bit of flexibility how you can apply that. Something that you don't necessarily get with rigid cuff. One of the problems we have when we're training cabin crew with rigid cuff is making sure they fit the right, the cuff to the furthest wrist in the seat first. Otherwise, it's a right mess trying to get it onto the other wrist. You have to take it off and start again. So, there are, as I say, the right equipment to the right environment. I have to say that some people prefer the rigid cuff. It's very easy to hold and, quite easy to apply. The chain link's a little more floppy, but they have, they have the uses. The soft cuff, well, let's go back to the beginning with the airlines. They purchased in all the equipment. There was big dog catcher leads. There was all sorts of things that had been invented by various people to try and strap a passenger in the seat. But as I said, the first consideration, this person has to sit in an aircraft seat, and you have to be able to get the seatbelt on so that they're safe when you land the aircraft. If you go, looking at the needs of the aviation industry. So that was the start. That was the starting point for the development of the equipment we introduced to the airline, was to work with seatbelt, because crew are familiar with it. Let's give them something familiar to work with. That way they're not having to work out how clips work and things. Okay, it's a piece of equipment they use. It fastens like this and it undoes like that. They do it every time they get on board an aircraft. So, we used equipment that they were familiar with to come up with a way of strapping a passenger into a seat that would hold them for the duration of the flight. And I think this is where a lot of the innovation over the last 20 years has come from, is people working in different environments, care, children's services, where they're looking for equipment that doesn't have the same potential for injury that you get with metal cuffs on board, or plastic cuffs to get into the flesh if they're overtightened and things like that. So people have looked for alternative restraints to reduce some of the risks, but you lose some of the security often. Or you end up with something that is so complex to work. You don't want to be doing tiny little movements when you've got somebody and you're trying to, restrain the wrists together wherever you're doing that. You don't want intricate movements and fancy bits of equipment and clips popping off in that process. So it's finding that balance between something that works, is as simple as possible to apply, and is designed around the reason why you're using it and in the environment that you're using it. So I think that's what's led to a lot of the development. I mean, again, speaking from personal experience, aircraft seats have changed a hell of a lot over the last 30 years.
Smaller.
Well, yeah.
Just to dig at airlines, a left foot room, more expensive.
Yeah, sorry, Phil. To buy cattle plus, yes, you're absolutely right. If you get all 10,000 quid for your flight, then you can get you a nice, comfortable pod that will roll out like a bed.
If they restrain you in first class, I'm going to be kicking off on every flight.
You'd be surprised how many incidents happen in first class. But anyway,
drinking, man.
So engine aircraft seat design, the original piece of equipment that we developed for the airlines, null and void, because you needed access under the seat and around the seat to be able to secure the person. So once you get out of standard class into business class and upper class, you've now got a different environment and a completely different problem to solve, which has led us to, be innovative about the equipment we can use in those settings. And the obvious, the obvious answer everybody gives is, well, just downgrade them, move them to a standard seat and use the original kit, which, if that is a viable option, we suggest to do. But if you have a spiral staircase between the first class and cather class, then that's trying to manoeuvre somebody down a spiral staircase creates more.
Let's go back to moving and handling again.
Yeah, than trying to secure the person in the environment that they're already in. So I've gone full circle back to the environment, but the procedure and the environment that you're working in are key to what equipment is best suited to that practice.
Yeah. I think though, you said about misuse. It's not quite a misuse because Phil's covered that, but it is about people introducing the wrong equipment.
Yes.
Yeah, because certainly, as Phil's alluded to there, and you nodded, but we have conversations with some organisations and clients, and for ease of simplicity, they'd rather have soft cuffs, even though it might not be applicable to that environment. Please, all equipment has its purpose in certain environments, but is that balance, isn't it? The right equipment for the right purpose.
And what level of security are you getting? Because if you go through a 8-minute struggle with somebody to physically restrain them, then apply the mechanical restraint, and just when you think they're secure, then peel the Velcro off and they're loose, then you're back to square one. And you try fitting a piece of equipment twice. Once the person knows what's coming, that makes the job twice as hard. So that's a consideration as well. Is what we've got going to work?
I think there's a challenge there, though, isn't there, as far as choosing the right piece of equipment. Is hopefully what everybody's kind of mentality would be, as far as but you need to know the kind of the positives and limitations. So yes, although we've got maybe the lower risk psychologically and maybe lower risk of harm to the person from a soft cuff type device, but as you said, if we're having to keep reapplying it, or the circumstances mean that's not going to keep them safe, or it breaks, then straight away, then that wasn't appropriate for purpose. But on the other side, you've also got then the powers that be, or perceptions of that we're putting any metal restraint device on somebody we perceive as vulnerable. That's immediately going, well, but you've got the soft cuffs, because again, they're coming from a position of ignorance, going, well, all mechanical, like any physical intervention technique, any manual restraint, nothing's foolproof. Nothing's like, well, use this one, that's it. You don't need any other technique. You don't need any other device. You don't need whatever it is. There's nothing that's absolutely perfect. It's, as you rightly said, Phil, the right for the right environment, the right for the right person. There's so many variables, but people don't always know what those variables are. The kind of the benefits, for also versus the pros and cons of any particular device, I suppose, and that's where it's going to the experts, isn't it? It's go to the people who use them, train them, develop them, and stuff like that, to kind of recognise.
Look at what you have to with. What's the typical person that you're going to be dealing with in this environment? What are all the factors that brings to the party? Again, in what environment are you going to use it, and its effectiveness, its safety and effectiveness, haven't you? I mean, as you say, super soft cuffs, all fluffy and soft, sounds lovely, but if you can just tear them to bits and take them off, then they're completely useless. Mm-hmm. So it's finding that balance between achieving the goal. Mm. Which, as I say, should be best option at that point in the cycle of behaviour, and that way you can justify its inclusion in that overall strategy. But it has to work. It has to be fit for purpose, and it's. But yeah, safety is one issue, but effectiveness, safety. You've got to struggle with somebody long enough to get them secured in some mechanical device, and then they just go like that. secondary stress on a major scale, I can tell you. Okay, when you have to start all over again when you're just ready for a cup of tea and a sit down. It is no fun for anybody.
Yeah.
And not for the person involved either, because they have to go through all that stress and strain again. And as I say, physical intervention is it's not something you want to be doing for a long.
Have either of you encountered, I know I have encountered, I haven't heard of it for a long time, this is a number of years ago, but handcuffs particularly started to get a little bit more accessible, or there was more training started to occur. And I do know of sort of certain, I've got one particular individual in mind. It was a doorman or door supervisor who often worked on his own, and yet he would also carry handcuffs, and that was always a bit of a concern for me. That is that bit more of he wants a Batman type utility belt, because he was definitely definitely what I felt was one of those individuals, making it look the part that I am security, whether it was appropriate to use. And I think there was some major concerns of them starting to be used within the SIA point of view. Obviously, that's all of us have had a little bit, but that's not my area at all. But Travell, what about your take on that?
Certainly. I mean, not just CIA security. If I use the generic term enforcement, lots of people in enforcement roles, and a lot of what we've been talking about, albeit it's not the terminology like people like to use, but we're enforcing, from a broader perspective. But I think that balance of, i.e., the individual we're referring to there, under the broader heading, it's work equipment. So for ease of discussion, when he, she, they are leaving home, then the work equipment shouldn't be on view, because I'm sure we've all seen the odd person who's carried them, had discussions which might be started with people later on about being apprehended by the police when they've got them and not their place of work. But importantly, when they arrive at work and, staying with security SIA, then a lot of it, isn't it, is individual appointment, albeit the working as part of a team, not always themselves. So again, when that person arrives at their place of work, then, and I'm not just using this to speak, but that discussion around, isn't it, whether the supervisor is the manager for that event or venue, so that supervisor, manager knows that individual's butt cuffs. If you was to authorize that there was a need for that person to operate with themselves, and then importantly, if they do have to apply, then they're doing it from, let's say, ideally from the perspective of 2 or more people. But I think it is that balance about, yes, it's work equipment. I think that's where, and yes, I've spoken to a lot of individuals who wrongly will travel from home to work and they've got the handcuffs on display, and then they wonder why they get stopped. You're like, well, come on, you're not being you're just being stupid, to put it crudely.
Yeah, you wouldn't be strapped up with kitchen knives if you were a chef.
Thank you.
Yeah, exactly the same kind of premise, isn't it? We're just referring back to the kind of the pure regulations, though. So this is where any employer needs to be careful, or employee as well, because I think under the stipulations of the majority of the legalities of mechanical restraint within things like the NHS and social service, they have to have it has to be written in the policy of the organisation whether mechanical restraints or what the use of mechanical restraints is allowed within that service. And therefore, if it is risk assessed by an organisation, whatever, that mechanical restraints may be necessary or may be part of their policy, then that would fall under the responsibility of the employer to ensure that workplace equipment is suitable, safe for purpose, and those are trained and competent in its use. But if I've just got my own handcuffs because I want to look cool, then straight away, if I use those, immediately I'm opening myself up to vulnerability in the fact that wasn't part of my workplace policy. But the employer also has a vulnerability if that wasn't actually workplace equipment. It wasn't checked, it wasn't tested, it wasn't checked, it was suitable for purpose. So I know there's certain, again, health and safety legalities are opened up by people, especially if they're providing their own workplace equipment. I don't know whether you've encountered that before at all. People carrying their own stuff. Or you mentioned earlier about the cable ties as well, that I do know some people started just carrying cable ties on them and stuff.
Well, if you go back to, there you go, anybody 30 years or younger, you could certainly, from a police perspective, it was the mid-90s before rigid handcuffs got introduced and officers were carrying them regularly about the day-to-day business. Prior to that, they had a wooden truncheon and chain link cuffs, which they very rarely carried out on the street. Not everybody, but the vast majority. So there was a big major shift then in the mid-90s, and that's when you first started to get introduced into the UK. I think aligned with that, if I start top down, then if we think about corporate manslaughter homicide act in terms of vicarious liability, sounds dramatic, but the point is, we've kind of touched on, we want safe application removal of mechanical restraints, but, use, Phil's gave lots of good examples there, where it might be appropriate around the environment, etc. So I call it when it gets busy, and we alluded to manual handling, having to manage people on the ground, and if it goes wrong, then, so as I say, although I'm talking about corporate manslaughter, but, this most senior person in the organisation, his or her vicarious liability for the health, safety, well-being of their staff and the people they're supporting. Can't rule it out.
Yeah.
I mean, another consideration in security settings for the people operating in a security role. Police response times aren't what they used to be. I remember doing risk assessments for the Home Office in the 90s, where the police response time was 4 minutes. If they put a call out that they needed assistance, the police response time was 4 minutes. And we were updating the risk assessments so 6-7 years later, and they were talking about managing prolonged restraint and managing people on the floor, possible floor restraints, or moving somebody from the floor to a seated position. And I said, how have we got to this? From the minute it kicks off and you call the police, they're there in 4 minutes. Not any longer, Phil. We've been told they'll try and get there within 20 minutes, but they can't guarantee it. So they said we've had to, so we had to change the risk assessment and the training to meet the need. They were then having to manage an incident for 20, 25, 30 minutes, which is a whole different kettle of fish to managing it for 3 or 4 minutes. And sometimes, I spoke to door supervisors recently in York that I know, where they say, there's no guarantee they'll turn up at all. And they're saying, unfortunately, the people that cause the trouble know this. So whereas before we could say, right, better make yourself scarce, mate, because we've called the police, they're on the way, it's down here. Now they know, that the police aren't, it's going to be a much longer period of time before the police turn up, if they turn up at all. Yeah. And they're much prepared to have a go. And the door supervisor said in 25 years, I've never known it was bad. Whereas before you could use that potential threat of the police arriving, which would be enough for them to get a bit shirty and give you a mouthful and scarf. Now they're prepared to stand and fight because they're pretty sure the police won't be there quick enough to catch them. Yeah. So if you're operating in a security environment, that alters your dynamic risk assessment when you're dealing with somebody drastically. Knowing the tolerance on its way is comfort to anybody. I mean, in the secure hospitals where I worked, the distance between the units was no more than 2 or 3 minutes. In Wormwood Scrubs many years ago, which was an old-fashioned prison with 4 separate wings that weren't joined at the time. I think they are joined now. But if an alarm bell went off in C wing and you were in A wing, it took you 4 minutes to run from A wing to C wing. Yeah, and with a bit of luck, it was all over when you got there.
Especially if you developed a gammy leg on the way.
But your response times are really important. It's like I say with the cabin crew. There's nobody coming. However bad it gets, there's nobody going to turn up and help them. Yeah. They do get friendly fire from passengers, and I presume, if we were on board an aircraft where somebody was endangering the safety of the aircraft or other people on board it, there are always people that will step up to the mark. Yeah. Usually. So but that then forms part of the training, managing that passenger.
But I've definitely come across it with response times or attitude anyway of within the health and social care sector. There's an expectation sometimes for staff to just, well, you're the staff, you handle it. So no matter how bad it is, because it's perceived as you should be trained, you should be able to manage these situations, your clients and stuff. Again, so therefore the police are almost unwilling to actually turn up to events. So it adds the same
Yeah.
kind of risk factors to it, doesn't it?
And the police, because the police don't know the person
Mm.
and their underlying cognitive problems or other influencing factors on why this person's behaving as they are.
Yeah.
The police come in blind. They see the behaviour and they deal with the behaviour,
Mm-hmm.
which can ruin a long-term relationship between staff and the patient.
Yeah. Yeah.
So I'm sure when we work in care settings or even some of the special educational needs settings where occasionally they have to call the police, we always say get somebody in from the police and have a discussion with them as to what response you want from them when they turn up.
Yeah.
Because if they just kick the door through and pepper spray them and cuff them, that might not be the response you were hoping for. So arrange with the police what response it is that you want when they get there, because often their presence is enough to calm things down. I think not physically have to get involved or say or do anything. Just having the blue light turn up on the drive at the school is enough to calm things down. That might be the only response you require. The police to turn up, say everything all right now? Yeah, it's all dealt with. Thanks very much for coming.
Again, it's very perception based, isn't it? There's some people kind of have this perception going, well, if it's that bad, the staff can just call the police. But as we've just established, sometimes that may not be appropriate in the best interests of the relationship and therapeutic relationship. We don't want to criminalize this individual when they're distressed rather than actually a major risk. But also, so therefore, it would be better for the staff to be able to deal with it if they can, because they know the person, they know the vulnerabilities, know the risks. But then you can't then tie their hands behind their back, and that's not a pun around mechanical restraint, limit their ability to take appropriate action, because you can say, well, you can just call the police. So they've got to have the skills and the abilities. And I think, to be fair, I think a lot of staff in more high risk environments get more training in how to safely physically intervene than most officers do. So they should be in a better position, but sometimes it still does go, but they don't have tasers or they may not have mechanical restraints. They may not have CS spray for the very, very severe situations. But yeah. So I guess, again, it's very nuanced.
There's an ongoing issue though, isn't there? Staying with care settings or special educational needs settings, but they'll call it police, because they deem that the person's that violent or persons are that violent. The police will come along and let's say for reason, the police manage to resolve it, but when they go to hand back over, well, the care system or the HK don't want that person because of the levels of violence. They're just afraid they might do it again. Yeah. And then we have the world of, then the police got somebody who would have got no safe place of residence for them. And as you're both probably aware, over the years, there's been various memorandums of understanding, which has kind of given that direction around care and educational settings to, if you should review their training, the police will always be there, but, as Phil mentioned, response times because of resourcing, and B, that balance, yes, if they're that violent, they'll get involved, but like Phil said, sometimes just be mindful in terms of your expectations might not quite be what you're going to receive in terms of how the police manage it.
Definitely, guys.
There's something I'd like to mention. I appreciate the time of it.
No.
I think there's that element of, if I call it an environmental setting, i.e., the air industry, as Phil's quite rightly been referencing with his knowledge, experience, and expertise there. And if I call it, that's environmental specific. But if it's not environmental specific, then we go back to the mid-90s when handcuffs first came in, let's say from a policing perspective, and there were either something like 28 or 32 techniques. One of those two figures is correct. That's what people were taught. It matters not, by the way, which one does it but with respect, talk about complex, not really complicated, but that's exactly how it was taught. Whereas now, generically speaking, we've all feel in particular, we've made reference to it, but by and large, there's 4 techniques by and large. And as with physical intervention, without going off at a tangent, the non-restrictive, restrictive, it's the nuances about what's actually applied. But the principles don't change, and as Phil was saying before, to the front, we link it under the heading cooperative, compliant, or we even need to explain to people what we mean by that. Otherwise, if it's a little bit more, let's say, perceptually or factually more risk, we're likely to puff into the rear. working biomechanically how the body works. But I think by and large, I don't know if you share that broader view, Phil.
I think I've still got the quick cuff video on the shelf there behind me, the old VHS with the myriad of techniques that you had to learn to become a quick cuff instructor, most of which was tosh and no use to anybody in a high stress situation. I remember the first airline that took on board aircrafts, took on board handcuffs. So they had quick cuff. They'd been trained by the police in quick cuff a year earlier. So they got out their training equipment, which included half a dozen pairs of quick cuff, and I said to them, right, just show us how you apply that, with at least 6 different variations of how these cuffs were applied, because nobody could remember how to do it. Some were just looking at them, they didn't know where to put them, because it was just over complex. Way over complex. And as I say, any restraint needs to be as short an experience as possible for everybody involved, physical or mechanical. It has to be the shortest possible experience you can create, for safety, for medical reasons, for stress levels, the relationship you have with the person, or anything else. For all those considerations, it has to be the shortest possible period of time for that to take place. Now, if that involves mechanical restraints, then that by its very nature says it has to be a fairly simple process. It's a high stress situation. You don't want to be trying to recall complex procedures and moves or fancy bits of clips to fasten. It has to be as simple as possible.
You won't be able to do them anyway, Phil. As we're very well aware, when we go into that heightened arousal state, complex motor movements go out the window, which is, so, when somebody's in a major meltdown, they're not going to be able to do that with shoelaces. So it needs to be kind of, very, very simple and applicable. So,
it's right back though, isn't it? You shouldn't handcuff until you've got control.
Yeah. Both emotionally and from both sides, absolutely. Yeah, that full circle round. Well, I think we've kind of reached a bit of a time there, guys. Unless there's anything else you guys specifically wanted to mention, I think we've covered the topic quite extensively.
No, I think I would just say again that mechanical restraints are not for every environment, for every restraint that takes place, for every physical intervention that takes place. They're certainly not suited to all environments, but they shouldn't be taken out of the process of consideration as part of an overall strategy for managing people's behaviour and certain procedures. It's got to be something that you consider. By all means, rule it out if it's not appropriate, but it's got to be something that's taken into consideration as part of that whole process. That would go fair, wouldn't it?
So popular for
it's certainly something that in all the environments we work in, at least come across one scenario where a mechanical intervention would have had a positive impact on that behavioural cycle.
I think just adding to what Phil said there, two fairly quick points. I think one, all training is about confidence, isn't it? Because until we apply the training in if you wish, in a day-to-day, live, real-life operational experience context, then we don't know how successful the outcome is going to be. So, certainly mechanical restraints being a complex item of equipment to use, and it needs to be as straightforward as possible, simple as Phil was saying. And I think the second point, then I think people should either A, understand the law related to the use of reasonable force himself, or B, know somebody who understands the law. And it's not meant to be flippant. I'm being serious, because there's so many policies out there, we can't possibly know them all. But some people's jobs is to manage upwards, isn't it? And I appreciate leadership should be transformational, I get that, but they know somebody can speak to who has a better understanding of the law, can come back so they can evidence their rationale for doing what they did in this instance, taking somebody's liberty away using mechanical restraint.
Yeah, thanks, guys. I think, to kind of summarise a few things we've kind of touched on there. One is that, Training is obviously a big part of mechanical restraints. So anybody who's utilising them, it should be appropriately risk assessed, and individuals should be trained and competent in their use. We definitely shouldn't really be working on blanket policies around anything, as far as definitely never, or we use them just as a matter of fact. It should always be very person-centred. All the principles we teach about all physical intervention and the right technique should be applied exactly across to mechanical restraints as well. But I think obviously there is a lot of different pieces of equipment out there on the market, and talking to different people about what the best solution to the challenge is that's in the best interest of all concerned in each of those circumstances are definitely part of the journey to getting it right. So thank you very much, Jan. Thanks for your time for this afternoon. It's been, I feel like we've covered quite a lot of ground. So hopefully people watching this can find this useful, interesting, and obviously please do comment. It'd be good to get some feedback, because I know there's some people who do watch the channel who are directly involved in mechanical restraints. We get to get their feedback on it, and anything that they feel we missed or they want to add to it would be great. But otherwise, gents, thank you very much for your time.
So much. Thank you.